everybody. My name is Dr. Marcia Tyak. I am one of the faculty for Nursing 6007, which is Ethics, Policy, and Healthcare Advocacy. This is currently our only PowerPoint that actually we're doing as a video for you today in the entire course. And I think we left it in there in order to sort of give you guys this very straightforward explanation of some of these terms, especially since we removed the textbook from the curriculum in this class. So this video should be short, kind of to the point, and give you just a general overview of what each of these principles means and why we even talk about bioethical principles. Keep in mind that this video is not a reference for you as far as when you write, and that includes discussion boards, reflections, or essays. You still need to find primary sources to defend what you are talking about and defend that perspective. But it's really just meant to give you sort of that initial flavor of what each principle is and why we talk about them. So let's get started here. When we talk about ethics in general, it's not as black and white as we would like it to be. It's just the nature of ethics. It would be great if ethics was like the cats on the left. There's a black one, there's a white one, everything is very clear, it's very concrete, to the point. But unfortunately, ethics isn't like that. And it often is like the cat in the middle with this sort of patchwork of of black and white, where it kind of ebbs and flows between the two. And oftentimes it's like the cat on the right, the very gray cat, where there is this blend of right and wrong, or what to do, what not to do. It's not as clear as we would like it to be, and it oftentimes ends up pretty muddy. When we talked in our values module, we discussed values as important to guide our ethical decision making. But while we all have values that influence our perspective and the lens through which we see a situation, ethical principles can serve as a more objective way to look at an ethical dilemma and guide ethical decision making. And when we talk about ethical principles, what are we talking about when we talk about the bioethical principles? There's a number of bioethical principles that can guide our decision making. And when we speak of principles in general, in our normal everyday vernacular, the term principles can apply really loosely to all of these, but then also to terms like trustworthiness and integrity and courage and determination. But when we speak of the bioethical principles, we mean very specific principles. And you see the most important ones here on the slide. These are what are oftentimes considered to be the 6 most important. Sometimes you'll see that there are 4 that are considered the most important, and those would be autonomy, beneficence, nonmaleficence, and justice. But these are the 6 that for this course and for your future nursing practice, we want you to most understand. So let's get started talking about each of them. The first of these 6, and oftentimes considered the most important, is autonomy. It refers to the right to decide, the right to freely choose without coercion, to choose independently without undue influence. For patients, it can apply to freely consenting to a treatment or a procedure, or to freely refusing a recommended treatment or procedure, regardless of what our recommendations are as providers of the best benefits of why they should have this procedure done. There is something called an informed refusal. And we're going to talk about consent and refusal in a future module coming up soon. But understand that those concepts of informed consent and informed refusal really build off of the bioethical principle of autonomy. The key to autonomy is that it requires the patient to have what's called decision-making capacity. And again, we're going to get more into that in a future module. But otherwise, autonomy is absolute. Unless someone lacks decision-making capacity, then autonomy and the freedom to independently self-determine what one wants is an absolute right. Now, we talk about that in terms of patients, but what do we mean in terms of healthcare providers? For healthcare providers, nurses, nurse practitioners, physicians, autonomy is also important, and it refers to the kind of professional practice we want to have based on our values and the principles that we think are the most important. We talk about what ethical lines a provider, in particular you as future nurses, won't cross. And you have the autonomy to be able to make those very important decisions to guide your practice. Beneficence is another bioethical principle. And you'll see, actually, this picture I chose here is a statue actually entitled Beneficence. It's on the campus of Ball State University in Muncie, Indiana. And it's a tribute to all of the good things that the philanthropists, the Ball brothers, did for the Muncie, Indiana community. So when you think of beneficence, think of what the students at Ball State call here is the statue is Benny. And beneficence is about doing good for our patients, for each other. The goals of the care that we provide should be to do good and to benefit our patients. Remember, however, this is different than doing no harm. And we shift gears now to non-maleficence. So beneficence and non-maleficence are often juxtaposed with each other, where beneficence is about doing good. Non-maleficence is about doing no harm. And that doing no harm refers to any either intentional or unintentional harm. Beneficence and non-maleficence, as I mentioned, often conflict. So a good example of this is medications with side effects. While the intention is to do good in the medication that we're prescribing or that we're giving to the patient, like chemotherapy or some diabetic medications, the side effects can produce unintentional harm. So for instance, chemotherapy can produce hair loss and vomiting and heart problems and lung problems and can produce cognitive problems. And certain diabetic medications can actually cause diabetic ketoacidosis. These are side effects that we don't intend, but that can go along with that medication. So when there's an autonomous choice to be made, we allow patients to decide for themselves whether or not there's a risk that they are willing to assume when they take these medications. The next bioethical principle that I want to touch on is the principle of justice. It's an obligation to be fair and to be equitable to all people. And there's no qualification on all people. It's just all human beings deserve the same treatment, the same consideration when ethical decisions are being made. Keep in mind that the principle of justice, the bioethical principle of justice, differs from the theory of justice, which we are going to talk about bioethical theories in Module 3. But they are different. And so while there are similarities, there are nuanced differences between the two. So let's talk a little bit more here about justice. Equality is often confused with justice. And we get a visual here for you in that the picture on the left labeled equality, there's a fence or a barrier in the way of the kids. Equality is that each child is being given the same or equal support in order to get past or see over the barrier. In the picture on the right, you now see a visual representation of equity. And here, rather than all of the children being given equal support, each child is given the support that they need as a unique individual to see over the fence or to get past the obstacle that's in their way. In this picture here, it demonstrates how some have gone even further, a step further, to suggest that equity still isn't enough to ensure true justice. So here in the first two pictures, you see what we saw on the last slide and what we've already been discussing. However, in the third, in this example, the image goes a step further to suggest what true justice should look like, and that it's not achieved until the cause of the inequity or inequality is removed. So in this picture, this image, you can see that none of the individuals require additional supports because the obstacle to their success has been removed. The fence has changed. You can see through it. And so all have what they need to achieve their goals and don't need additional supports. This is true justice. I want you to keep this image in mind and keep these comparisons in mind throughout the semester, especially as we get around the midpoint of the semester, when we start to get to social justice and policy topics, like I said, right around the midpoint of the semester. Fidelity is about faithfulness and following through. Faithful to commitments as part of this profession, to our patients and to ourselves. Our patients recognize this principle of fidelity within nurses. When patients and families see their nurse, they're not thinking, "Oh goodness, I sure hope they're competent or that they know what they're talking about or know what they're doing." But rather they're thinking, "Oh, okay, my nurse is here. Somebody that I know knows what's going on. Someone that I know has dedicated themselves." And with this COVID pandemic, I think we see this more and more, what people view their nurse as being, with their true dedication to the profession. Remember that nurses are consistently rated the most trustworthy profession. And while we're going to talk about trustworthiness in a second, I think that this feeling of that I can trust my nurse has to do with fidelity as well. It has to do with knowing that nurses are dedicated to their profession and dedicated to the life that they've chosen to be able to give back and to patients and take care of patients. Fidelity is also what obligates us as nurses to do better, to grow more, to ensure professional growth, to when we do continuing education, when we look for ways to continue our growth, even if that doesn't mean necessarily going back to school for another advanced degree, it could be that you want a specific certification or just that you want to maintain your competence as technology and healthcare changes over the years. Veracity is really truthfulness or trustworthiness. It's similar to the root of the word verify, which is to double check the truth. If I'm going to verify something, I'm going to make sure someone is telling me something that's been accurate. It requires that nurses tell the truth and not intentionally mislead or deceive patients. And this can be difficult. This can be difficult in end-of-life scenarios where patients and families have a hard time hearing the truth, or where telling the truth can be really, really difficult. Young cancer patients, kids, veracity, this concept of veracity can be in conflict when children, for instance, are dying of their cancer. And because they're minors, they're under 18, they don't technically have the ability to give informed consent. They're not technically their own person. But what happens when a parent says, "I don't want my kid to know. Please don't tell my child they're dying." Or "Please don't tell my child why they're having this surgery." this puts us at an ethical dilemma. And just on that note, I will tell you that the literature shows that kids already know. And it's actually the kids that tell providers, don't tell my parents, but I know I'm dying. So an interesting aside nonetheless, but these ethical dilemmas do come up, and veracity is being challenged in these scenarios. Finally, I'm going to mention utility, and I've included utility on this final slide because it's a seventh bioethical principle that you should at least understand on a very basic level, because it's going to be demonstrated in the next module where we talk about bioethical theory, specifically utilitarianism. And remember what utility is. It is engaging in activities or behaviors that produce the most good. So something that has high utility, for instance, like mandatory mask rules in a pandemic, produces the most good for the most amount of people. And so that's where the concept of utility comes from, and where that will lead into understanding better utilitarianism as a theory when we get to that module.